So, Dr. Kadish, we know that you have used pediatric CPAP in a situation that is even a little outside of the norm that we talked about with asthma, sepsis, retractions, grunting, and all that stuff. Talk to us specifically about the time that you guys used it on a near drowning.
Yeah, so this was not me. This was my awesome Columbus Fire crew. But they arrived on scene and there was a little 18-month-old boy who'd been pulled out of the bottom of a swimming pool. And when I think a first responder got there first, had started some CPR, and by the time the medic truck got there and the crew assessed the patient, he did have a workup breathing, and he was breathing on his own and he had a pulse. So he wasn't fully alert and awake yet, which is okay. But they said, let's try CPAP on this kid. And there was a brand new medic on that truck who just finished paramedic school, and they were probably, thinking about that lecture I gave them on pediatrics and respiratory distress, and they're like, let's do the CPAP. And the child, I think when they listened to the lungs, they just heard, crackles everywhere, and the lungs were very wet. And they strapped the CPAP on the face, and they watched their oxygenation go from, the high 70s up to the high 90s during their transport time. And so that kid ended up, transitioning onto BiPAP when they got to the ER and admitted to the hospital, but they saved that kid an intubation.
Mm-hmm.
100%.